Here I am with Tony again. Here we are. I mean, Tony spent over 10 years in clinical, running Roche's clinical research. I mean, what's going on in clinical at the moment,
Well,
Tony?
I think this is another thing we want to try and get on our radar. We want to try and we really want to run an event if we can, which is more on clinical strategy than it is clinical process. And there's a lot of clinical process stuff out there. But my question always is when should some person who knows about clinical get involved, and what is strategic? Not, building it, saying, well, we're going to do this study in this site. It's more like disease types, and we've got this thing nowadays, Graham. We've got so many chemicals.
Right.
The trick is what diseases we put around the chemicals, rather than the older days where we were looking for new chemicals. So this is it.
So when the people start talking and thinking about the clinical side of things, I mean, quite often that's like 5 or 6 years down the line. I mean,
exactly. Well, I think that's the question we need to pose in one of our events: is if you're going to get involved early, what do you talk about? Because a lot of people will say, well, I've got nothing to say. But the answer is you have, when we're trying to work out what the diseases are. And that's the question: what is the disease? Because the disease is now the issue, not the drug. Because we've got to wrap the right disease around the drug. And with old drugs still being used for many indications such as ADHD, we've got to do something. So look forward to talking more, Graham.
Sounds good.
Sounds fantastic.
Any
ideas,
for
please send it to us.
Thank you. Bye.